Hello ladies and welcome back to my channel. My name is Aisha, aka Nurse Aisha. For those of you that are new to this channel, welcome to our female to female conversations. Here you will receive health education from a nurse perspective. Those of you that are regular to our channel, thank you for supporting our work. Today we are going to talk about postpartum complications. Basically, complications after you have had your baby. Depending if you are a first-time mother, you have probably gone through labor for a long period of time, many hours, pushed and pushed, and you are tired. Postpartum complications can be many, but we're going to break them down today depending on how minor they are or severe. We're also going to discuss the ones that are more common. So the first one that I want to discuss is the stitches and the soreness. Now, not everyone gets stitches, but some women might get stitches depending on if they've had a tear or a cut during birth. So when you're giving birth, you might be too tight in your vaginal canal, so the doctors might want to give you a cut in order to get your baby out. Now, if you're a first-time mother, that is very common, or if you have experienced FGM, female genital mutilation, unfortunately. So there you definitely need a cut to get the baby out. So after you've received this cut, you get stitches. And when you get home, it's sore, hard to sit, hard to urinate, hard to do number 2, and you're probably experiencing very much uncomfort. What you need to do is make sure that you give yourself a warm bath. Make sure that you don't get infections. Make sure that you are not constipated. Make sure that you keep your bowel movements soft so you don't have to squeeze it out. This is very important so you don't tear up again and cause an infection. So the second complication that is very common is piles or hemorrhoids. Now, this complication can also come during the carrying of the baby, not only postpartum complication. So what happens is you get swelling around your rectum, and this is due to pressure on the rectum. You're carrying a baby and it's heavy and it's putting a lot of pressure on your rectum. So this complication is very well known, and you can also treat it at home with a hemorrhoid cream. So after pushing a baby for 6, 7, up to 20 hours, the pressure of pushing the baby out puts a lot of pressure on the rectum, so that can cause hemorrhoids to develop. What you need to do after you're home with your baby is to make sure that you stay hydrated. This could be very painful, but it's very common, and make sure to not get constipated. So what could be alarming about hemorrhoids is that they could bleed. And the reason for hemorrhoids to bleed is that you are putting more pressure while doing number 2. The best thing to do is to make sure that you get a good laxative so that you keep your bowel soft. This is very important. So make sure you stay hydrated, get vegetables, fruits, and whole grain meals to make sure that you don't get constipated and you don't have to push. It could look really, really bad when you're bleeding from your rectum, but make sure that you talk to your doctor or you get any laxatives off the counter to keep your bowel soft. And when you do that, the hemorrhoids could reverse. They can go back without any treatment, but most times you need treatment. So the third postpartum complication that I want to discuss is bladder incontinence. So after you've had a baby, you might experience some stress incontinence, most probably when you cough, laugh, or you get up really quickly. You might experience a little bit of urine leakage. This is very common. This is due to the long period of pressure on your bladder. So this is a very common condition and it can be reversed. it's very important that you recognize this and you talk to your doctor or your midwife about this so it can be reversed. So what your midwife or your doctor will do is they will recommend you to a physiotherapist so you can get your pelvic muscle exercises going. Every woman should know how to do pelvic floor exercises. You can do them anywhere, anytime. I'm doing mine right now. It's very important that you get these muscles back in shape after having a baby. Even when you're planning to have a baby, it's very important that we get our pelvic muscles back in shape. The fourth postpartum complication that I want to discuss is an infection and sepsis. It's very common to get an infection, both locally but also overall. If you develop a fever, a high fever, and you really don't feel like yourself, it's very important that you seek professional help. Go to your nearest hospital and make sure that you tell them about what you've been through. You just had a baby, you're sore, you're experiencing pain or perhaps pus locally coming out. This is very important that you verbalize and tell your doctor so it can be treated early so you don't develop a sepsis. So the infection can lead to a sepsis that is life-threatening. This is also important for your baby who you're probably breastfeeding, that you do not develop a fever and an infection. So make sure that you stay healthy. You could take some paracetamol for your fever, but if it continues, it's very important that you seek professional help. So another postpartum complication that I want to discuss is a vaginal prolapse. So a prolapse is what happens to an organ when it leaves its socket and hangs out of the body. So when it comes to a vaginal prolapse, this is commonly because of a vaginal delivery, but it can also happen if you've had a C-section or if you're a woman that is obese. So obesity is one of the common causes also for a vaginal prolapse. If a vacuum is used in a vaginal delivery, this can also cause a vaginal prolapse. Other causes of a vaginal prolapse could be chronic constipation, but also a hysterectomy and aging. As you age, your muscles become weaker, and this can cause a vaginal prolapse. A prolapse can also happen to the uterus. So a uterine prolapse can also happen due to a vaginal delivery. This all can be fixed surgically, but ladies, we also need to do our pelvic floor exercises. Now, after you've given birth to a baby, it's very important that you do your pelvic floor exercises. That is one of the solutions if it's a minor prolapse. But if it's a very severe prolapse, you need to go to your doctor to fix this surgically. So the last postpartum complication that I want us to discuss is anal fistulas. Now, a fistula is an abnormal tunnel that is created between the bowel and the anus. This can cause you to leak feces. Through your vagina, you will notice a smelly odor that is uncomfortable. You might notice that you're not properly holding your feces. This is very common due to prolonged delivery, but also because of the pressure on the anus and your bowel. So this is very common in bad condition, poor conditions of delivery. It also happens to women that do not talk about it. Now, if you notice that you're leaking feces, this is not normal. You need to talk to your GP about this. You need to talk to your doctor so you can get a rectal exam to know if this is a fistula or something else. So you do a rectal exam, you do an MRI or CT scan to notice if there is this abnormal tunnel between your bowel and your anus. Now, when that is done, then you go in for a surgical procedure. It's not complicated to fix a fistula, but you ladies need to be verbal about this. You need to be honest with your doctor and talk about your symptoms. Talk about when it started and how long you've been going with this. If you don't talk about it, you cannot get it fixed. Anal fistulas affect many women that give birth in poor conditions, in a hospital where they're neglected, or home deliveries where they don't get good postpartum care that is needed. Now, there's so many NGOs that talk about anal fistulas and try to get rid of the stigma around anal fistulas. Now, these NGOs can offer the emotional help that you need. But first of all, awareness is needed, treatment is needed, and if you are a woman and are suffering from an anal fistula, make sure that you join these groups, make sure that you talk about it, and that you get the help that you need. Do not suffer in silence. Talk about it. Thank you for watching.